If you're watching this, you might have recently been told you've got high blood sugar or blood glucose, pre-diabetes, or even type 2 diabetes. Maybe it came as a shock after a routine blood test, or perhaps you've noticed changes like fatigue, thirst, or brain fog that led you to go to your doctor. And you may well be feeling anxious about what comes next, worried about medication, complications, or how this diagnosis could change your life and independence. And on top of that, everywhere you turn there's advice from friends, family, internet, leaflets in the GP surgery, some helpful, but most of it leads to confusions because you'll find that advice is contradictory. One person says cut out sugar, another says it's all about calories, and someone else tells you just eat healthily and exercise. But what does any of this really mean for you right now in your real life? If you're feeling bombarded, confused, or just plain lost, you're really not alone. You're not failing. You're just living in a world that hasn't caught up with what people like you at this stage with your experience really need. And let me introduce yourself. I'm Nerys. I'm an NHS GP and founder of the Lifestyle Clinic. I started this clinic because after years of seeing patients in those rushed 10-minute appointments, I was tired of seeing people blamed for things that aren't their fault and set away with advice that simply doesn't work. So my mission was to give you real answers, real support, and hope that you can take back control so you can write your own story. Today, I want to talk about the 8 biggest myths I see keeping people stuck, frustrated, and doubting themselves. These myths are everywhere in the media, surgery, and even in our own heads. So let's go through them together. Myth number 1, diabetes is just about sugar. So how many times have you been told just cut out the sugar and you'll be fine? Maybe you've swapped biscuits for fruit or switched to sweeteners in your tea, thinking that's the answer. But here's the truth. Type 2 diabetes is not just about the cakes and the sweets. It's about how your body handles all carbohydrates. So bread, pasta, potatoes, even healthy breakfast cereals. When you eat these foods, your body breaks them down into glucose or sugar in your blood. The real issue is insulin, the hormone that helps move that sugar from your blood into your cells. Because over time, your cells become less responsive to insulin, something we call insulin resistance. And your body needs to make more and more to keep things in check. And that's when the blood sugar starts to creep up. So yes, cutting back on obvious sugar absolutely helps. But the bigger picture is about how often you eat, the types of carbs you choose, and how you can help your body become more sensitive to that insulin again. It's not about never having a treat. It's about understanding what's really going on. And here's something important. You didn't cause this by eating a slice of cake or having sugar in your tea. For most people, insulin resistance builds up quietly over years, sometimes decades, often without any symptoms. It's not about one food or one choice. It's about the whole pattern. And the good news is that you can change that pattern. The second myth is that you've caused this and this is your fault. Oh, this is one I see so commonly. I see people felt guilty in the doctor's surgery, maybe a comment by a friend or family member. This wrong belief that it's due to a lack of willpower. It is not your fault. Weight gain, blood sugar issues, stubborn belly fat are influenced by your hormones, your age, your stress levels, your sleep, and your genetics. And years of advice that never worked for people like you. You're not lazy, you're not broken. You do your best with the information you've had. But now is time for better information. Nobody thought that reversing type 2 diabetes was even a potential 10 years ago, but now we know. Diabetes and weight gain are the results of complex biology, not character flaws. Hormone shifts after the menopause, muscle mass decreases, stress and sleep all play a role. Add in decades of dieting, conflicting advice, and it's no wonder that you feel at a loss. The third myth is that you have to give up all the nice foods, your favourite foods, forever. So for example, being told you need to cut out bread, pasta, potatoes, even fruit. Can't eat cakes. Can't add sugar to tea. It's enough to make anyone feel deprived. But the truth is, it's not about never having a treat or living on rabbit food. It's about patterns, not perfection. You can enjoy those foods again. You can have the occasional pudding, a slice of birthday cake, or your favourite Sunday roast. The magic is in what you're doing most of the time, not what you do once in a while. And when you learn to balance, Give your body breaks when it needs it. You'll find you can enjoy treats without guilt or backsliding. It's about learning how to eat in a way that supports your body, your hormones, and your blood sugar, without feeling like you're missing out on life. This isn't about punishment or deprivation. It's about finding a way of eating that you can live with and enjoy for years to come. The fourth myth is that once you have diabetes, it's all downhill from there. Maybe you've heard that diabetes is a progressive illness, so that it can only get worse and you'll need more medication with time, more restrictions, more appointments, and more problems. But what the science really shows for many people is that diabetes can be improved, managed, and put into remission if you make the right changes. Your body is always trying to heal, no matter your age or how long you've had your diagnosis. You're never too old, too stuck, or too far gone. Change is possible and it's never too late to start. I've seen countless people in their 60s, 70s and 80s turn their health around, sometimes after decades of being on medication. The body is resilient. You just need the right tools, the right support and the right mindset. Myth number 5 is if your blood sugar is borderline, you don't need to worry. If you've been told that your blood sugar is a little high but not enough to worry about, classically in the pre-diabetes range, please do not ignore it. Borderline or pre-diabetes is an early warning system. It's a chance to make changes before things get more serious. Think of it like a warning light on your car dashboard. You wouldn't ignore it. You check what's going on underneath the bonnet before it turned into a breakdown, or at least ask somebody who knows. The sooner you take action, the easier it is to see real results. This is your opportunity to nip it in the bud. Early action can make all the difference, sometimes even preventing diabetes altogether. Myth 6 is a big one, thinking that the tablets will sort everything out. It's so easy to believe that medications alone will fix diabetes. After all, that's often what we've been told. Take the tablet, the numbers will improve, job done. But here's the truth. While tablets can help manage blood sugar, they don't address the root cause. They don't make your body more sensitive to insulin or tackle the reasons your blood sugar rose in that first place. Relying only on medication can mean missing out on the chance to truly improve or even reverse your condition. Lifestyle changes like adjusting what you eat, when you eat, moving your body, managing stress and getting enough sleep make a real difference. Tablets are of course a helpful tool, but they aren't the whole answer. You have more power than you've ever been led to believe. And the 7th myth is that it's too late to do anything. I've had this for years. I've said this already. And maybe you have lived with high blood sugar or diabetes for a long time. Maybe you are thinking, oh, I've missed my chance. It's too late. But science and experience say otherwise. Your body is always capable of change, even after years of high blood glucose. You can still make improvements. You can still lower your risk of complications, feel better, and enjoy more energy and independence. I've seen people make progress in their 60s, 70s, and even 80s. It's never too late to start. Don't let anyone tell you your best days are behind you. You've got the power to shape your future. And the last myth, you have to do it alone. It's easy to feel isolated if you only see the nurse every 6 months and rarely, if ever, get to see a GP. You might leave these appointments with a printout, a number, or a vague suggestion to just lose weight or to eat better. And then, of course, it's back to real life with all its pressures, confusions, and you're left to figure it out on your own. It's no wonder people feel isolated or even abandoned. You don't have to do it alone. There are support agencies out there, places and people who really understand what you're going through and can offer practical, compassionate advice. And that's exactly why I've created the Lifestyle Clinic and this video series, to give you a place to learn, to ask questions and get help from somebody who gets it. So if you're feeling isolated, I urge you to do something about it. Humans do better as a group or a tribe, so go and find them.